COVID-19 in the province. And the information that will be coming here is to communicate with the people of our province the work that they are also part of in kicking the virus to the curb, as they say. We appreciate your continuous attendance of this briefing and attention that you give to content that we share with you on a regular basis. These are most difficult times for everyone. So your sacrifices are a huge contribution. So I'm going to invite the Premier of our province and to give the media statement, because there's a big match today. I would like to share the information that some of you don't know. The Premier is a big fan of Orlando Pirates. So if you sit down with him, he will tell you about when he supported Kaizer Chiefs at some point. So the jury is still out on where his loyalties lie tonight. So without wasting time, Premier, can you please come to the podium? We will then take questions as when the Premier is okay, good. When the Premier is done speaking. Thank you, Premier.
Thank you very much, Mr. Stwesha, our facilitator for this media briefing. Good morning, MEC for Health and DG, Superintendent General, our reps from Mercedes-Benz, South Africa, and you media, people from various media houses, good morning to you all. Welcome once again to our COVID-19 weekly media briefing. We enter this week with very heavy hearts, as we have lost 466 people in our province to COVID-19 in a space of 9 days. This is painful reality and experience to these families and to those of us who knew each of those we have lost to this virus since March. Once again, we extend our deepest sympathies and heartfelt condolences to the families of the deceased, and we wish them strength in this difficult period. The passing of 466 fellow citizens takes the COVID-19 fatalities in our province to 2,255. Age, comorbidities in diabetes, hypertension, HIV, asthma, cardiac diseases, cancer, and obesity all contribute to this sharp rise in our mortality rate. Besiyithethileke lento kwangaphambili yomgcineni kuba le ntsholongwane iyathanda kakhulu ukuba nolwamvila kwimeko enjalo. Yiyo loo nto ithi yosele kubantu abanezifo abaphila nazo. Siyaphinda kwakhona sicela abantu abanomgcineni abahamba nabo balumke ngakumbi bona bazigcine ezindlini. Yiyo loo nto sithe abasebenzi bakarhulumente abane-comorbidities mabasebenzele emakhaya. Among the deceased are 85 healthcare workers who have been on the front line saving the lives of our people in our healthcare facilities. The relentless coronavirus struck again at the heart of our healthcare fraternity, this time around claiming the life of our professor, Professor Lungile Pepeta, who had served in the public health sector diligently for 21 years after receiving his medical degree from Walter Sisulu University. What pains me the most about his sudden passing is that I was in constant communication with him. He was in good spirit and he was assuring me that he will defeat the virus and get back to the front lines. Even when I was asking him to take it easy and focus on his recovery, Professor Pepeta wanted to know about developments in the work we are doing to fight the pandemic and offered advice from the hospital bed he was lying in, because his purpose in life was to save more lives. It seems as if the coronavirus is trying to distract our stated mission as this sixth administration of utilizing the best human capital of this province to accelerate socio-economic development in our province. I say this because the passing of Professor Pepeta follows that of Dr. Mnyande, who was a board member at the Kucha and one of our commissioners in the Provincial Planning Commission, and the passing of Reverend Dr. Namisa Chabula Nyewen and many other people whom we have lost that have actually left an indelible mark in the fight against this virus. We roped in Professor Pepeta to serve in our panel of experts on COVID-19, and this is where he was constantly providing valuable inputs passionately every week so that we can make informed decisions. We were still in the infancy stage of working together with him and other health experts to address healthcare provision challenges to ensure that post-COVID-19, we have an improved healthcare system throughout our province. He was an extraordinary human being who did extraordinary deeds. That's a reason why we had to apply to the president to honor him with a special recognition. And indeed, our president has approved our request, and the Professor Pepeta will be buried under the ambit of a special provincial official funeral category 2 in Mbizana on Wednesday, that is tomorrow. Government is working closely with the family on logistics. May his servant soul rest in peace. This week, we want to highlight 3 developments that we feel are critical to ensure our success in the fight against COVID-19 in our province. The first one relates to ensuring clean governance. As you all know, government has made special allocation of funds during this period to save the lives of our people from this pandemic. These resources are used to procure PPE for frontline workers and to improve infrastructure in our healthcare facilities, including availability of essential supplies. There have been concerns in the public about procurement of goods and services related to COVID-19 with claims of suspected corruption and beneficiation of companies with links to political and administrative leadership. Since the start of April, the Eastern Cape provincial government has paid invoices to the value of more than 582 million to companies for PPE, renovations in our healthcare facilities, and provision of essential supplies. We have taken a decision to publish the names of the companies that have benefited from our procurement and the names of their directors on the website of the Provincial Treasury. By publishing the list, we are introducing a new culture of transparency in our supply chain management. The people on whose behalf we serve have been calling for transparency. We are obliged to their request. From now onwards, we aim to do regular publication on the transactions the provincial government makes with companies. This will give the public an opportunity to follow every rand and cent of the public resources we spend. It will also lift the veil on who benefit from procurement in the province, because there is a perception out there that government spending benefits family members of government leaders and their friends. Others argue that government spending only benefits companies outside the province. Now that the list is published, the task is to separate facts from fiction, reality from myths, and truth from distortions. Treasury is also working on a much more sustainable, transparent way or system that it will also be inculcated into our system on this issue of supply chain. We want this to be done in a very open, transparent way so that those who bid can feel comfortable if things don't go right, so that we stop and minimize all the challenges of courts, etc., because of different information that people get out of this process. We therefore encourage the public to scrutinize the published list and give law enforcement agencies any information about wrongdoing and corruption they are aware of in the awarding of contracts to the listed companies. Out of 611 service providers appointed for mainly PPE-related procurement, 497, that is 73% of suppliers, were Eastern Cape-based suppliers. 5 government departments spent over 1.1 billion out of this money. 875.4 million went to the Eastern Cape suppliers in line with local economic development procurement framework. One of the things that worries us about some of the companies on the published list is that many of the companies might have purchased the goods they supplied from companies outside the province, which defeats our local economic development agenda. We do not blame the business, though, because there is a limited manufacturing capacity of goods in our province. Hence, we are resolute in our endeavor of growing the 2 successfully special SEZs, special economic zones, Kucha and East London SEZ, accelerating and the establishment of the Wild Coast SEZ, and the revitalization of industrial parks in our province to grow our manufacturing base. Linked to the publishing of the list of companies that have benefited from COVID-19 procurement, we have taken a further step inside government to conduct lifestyle audit of key leaders in government. This will help us to know the real sources of income for all decision makers. We can only rely on the DPSA disclosure process only, not that we don't trust that process. We have approached the state security agencies to conduct independent lifestyle audits in our administration to complement the work that the DPSA disclosure process does. The more mechanisms, the nearer to prevent and stop the rot of corruption in the government. Initially, the lifestyle audit will be conducted on the Premier, MECs, DG, HODs, DDG, CFOs, and all chief directors or any senior person in the supply chain management units in the provincial administration. In the long run, this will also accommodate the municipality space. I know there's work that is being done from the relevant authorities to ensure that we deal with this issue holistically. The entire ecosystem must respond to this kind of initiative as part of our commitment to cleanse the system and ensure that all those who occupy this critical space are held accountable at the regular intervals. We want to make sure that everyone who makes decisions or recommends decisions on procurement of goods and services will have their lifestyle audited. We call on every person who occupies the position I have just mentioned to cooperate with this process and to disclose correct information with honesty. Siyasinceda ke lonto basisebenzisane We are mentioning these ones, but also including their partners. So if you are a premier, you've got a wife, that also takes care of the situation, that you must also come forward and be part of this process, including your partners, your permanent companions, and husbands and wives, etc. Also the families that are related closely to those that we have mentioned. The second development we bring to you relates to our continuing and phenomenal partnership with the business sector. The business sector, without really classifying it on a scale of big or SMME, has been our pillar of strength in the fight against this virus. Not only have they continued to keep paying salaries, utilizing the UIF, many businesses are providing food to the most vulnerable in our communities, while others are supplying PPE. Today, Mercedes-Benz South Africa is joining these patriotic companies in their humanitarian gesture by also pledging solidarity on humanity in donating much-needed personnel protective equipment for the war against COVID-19. What we did not expect are 4 vehicles that will be used by our officials to do their field work on COVID-19. Our fight against this virus is now powered by yet another reputable, good corporate citizen with the German roots. We appreciate this helping hand because as government, we cannot fight this pandemic alone. For 70 years, MBSA has called South Africa and particularly the Eastern Cape home, and we are hopeful that our partnership will continue for 70 years more again, long after most of us have gone. We announced last week that we expect our infection rate to grow more than double in the months to come because the storm is not yet over. The donation of 3D printed face shields, surgical masks, hand sanitizers by Mercedes-Benz South Africa will help us to prevent more infection in our healthcare workers. More than 5,000 healthcare workers tested positive for the virus, and this requires us to prioritize their protection. If we do not do that, there will be a disaster in our hospitals with no healthcare workers to care for the sick. The third development we bring you this week relates to progress on the work of the project management unit. The Deputy Public Protector Advocate Kollega Galega was in our province last week, and media reports of her visits are highlighting the very same issues of an ailing health system that Dr. Zungu and her team identified. That is why we did not hesitate to set up the PMU and gave Dr. Zungu the responsibility to lead the PMU so that it can find a cure for our ailing system. I'm impressed by the team's work ethic so far and their deliverables. It will also have been a betrayal of the mandate we have been given by our people of this province if we couldn't respond in the manner in which we have responded. We can safely say we are a step ahead, but the insights in the report of the Deputy Public Protector will definitely assist the PMU in its work. We were in the same hospitals, coincidentally, the same day. We were doing our monitoring and evaluation of the work that we're doing, responding to calls that were made, and we saw progress from what was reported. If you look at the articles by BBC and others, that indeed work was being done to fix and correct those kind of challenges that were reported before. So work is being done on the ground to really attend and really address these chronic challenges that are historic and systemic in our system. As you all know, the PMU is here to respond to the healthcare of COVID-19. The health challenge they are here to fight is showing signs of vulnerability as we are consistently observing positive declines in trends across the province. our major development is that more than 77,000 people have defeated the virus. That means our recovery rate is now at 93.9%, a phenomenal rise from the 52% we were at on the 1st of July. We also see a consistent decrease in the number of new cases per day, which is still below 1,000. For instance, yesterday we only had about 177 new cases. This has been the case for some time now, even when testing was done at a larger scale. There is absolutely no strain in our testing labs as they continue to produce 90% test results within 72 hours. We now have only 2,773 active cases in the Eastern Cape. From these numbers, we can deduce that the end of our nightmare might be closer than we anticipated. As you can see that we are indeed plateauing now, and we are really trying to level the curve. So that's work that comes out of the effort, collaboration that all the stakeholders, workers, social partners have been putting into the system. From these numbers, yes, indeed, we can deduce the end of our nightmare earlier than what we thought. Our effort to fight this enemy has been reinforced by another 10 Cuban brigades who have recently joined their compatriots in our province. We welcome them with warm hearts as they bring more experience on the importance of primary health care. We believe that that's a solution. We need to invest on the primary health care moving forward. This curative approach is too expensive and it's not sustainable. Unfortunately, we've been locked into this because the health care has been actually reduced into a kind of a commodity. So we've got to understand and change our thinking and our attitude around that. I think the policy of the governing party is clear on that one. That's why we're working towards the NHI, which we expect it to be on a full swing by 2026. Today, we want to give credit to the local jobs headed by mayors, which have changed to ward-based rapid response teams for being on the ground every day, ensuring that our intervention program yield positive results in our communities. We also want to credit the role that is played by individual people in our communities who continue to adhere to protocols of wearing masks, sanitizing, and washing hands with soap, and who maintain social distances. So we need to also think about this social distancing with more emphasis on physical distancing so that we are able to separate this a bit, and it must be understood as such. The cooperation of the majority of our people has been nothing short of magical during this time. They agreed to the postponement of the traditions of Ulwaluko and saved the lives of young boys who would have undergone the rite of this passage in June. They also postponed festivities such as weddings and traditional ceremonies that are done to appease ancestors to save lives. We applaud the role played by traditional leaders in convincing families to adhere to our request for the postponement of these activities. Our efforts would have been futile without the participation of various stakeholders such as leaders of political parties, business and religious fraternity, academic, traditional leaders, labor and civil society in our extended command council. We can safely say victory is certain now because of this collective collaborative effort that we've mentioned. Phaya siqaphela phaya ezilalini basinayo ingxaki kule nto inento okwenza namanzi. Njengoba sikhuthaza abantu mabahlambe izandla, uDepartment of Water Affairs esebenza ne-district municipalities besenza unako oqinisekisa uba amanzi akhona nasematankini apha angekho khona kufakwa amatanki njalo njalo. Zikhona indawo ezinamanzi ezinezischemes zamanzi. Siqapheleke into yoba ikhona intlonti eyenziwa yi-community apho amanzi afakelwa i-community, abantu benze ii-illegal connections. Umntu ajike amanzi enzelwe ukusherwa yi-community kwi-scheme esenzelwe lo system, awajike yena ayozenzela itepu kwakhe ngamanzi atreatwa ngeerhafu zabantu enzelwa abantu bakuthi, amanzi acocekileyo, amanzi otyiwa. Sibone abantu benkcenkceshela igadi besenza ezinye izinto ngamanzi aye acocelwa into kokuba makatyiwe ngabantu. Loo nto imosha ezaa schemes. Kungekudala uve kuthiwa amanzi akaphumi, izischemes azisebenzi, xa ufika itepu aziphumi manzi. Uninzi lwaloo nto lumoshwa zezi illegal connections. Thethile nomasipala, i-district municipalities to do audit around this. I think it's a matter that we must bring it to police because kophulwa umthetho. Siyabacela ke abantu abenze ezi zinto barhoxe babuye umva kule nto yokuconnecta iitepu zamanzi because badisrupta le system yenzelwe ukusherishwa i-community yonke kuba umuntu efuna uba netepu ekwakhe eziphilisa ubomi. Ubufuna ukwenza loo nto iza ngaphambili ukuye kumasipala akwenzele wakugqiba uhlawule intlawulo efanelekileyo ngosebenzisa amanzi ngolo hlobo ufuna usebenzisa ngalo. Njengoko siyazi uba nasezifama amafama ayawabhatalela amanzi ayawasebenzisa for i-farming njalo njalo. So abantu bakuthi mabayi-appreciate loo nto because xa amanzi engaphumi kuthukwa urhulumente, kuhlaselwa urhulumente, babe abantu abenze le nto bamanzi angaphumi amaxesha amaninzi ingabantu abahleli apha phakathi kwabantu kuba ingabantu abathile abahlonitshiweyo nabaziwayo aboyikwayo, kungabikho mntu othi kubo kwi-community irongo le nto niyenzileyo yokusebenzisa i-system karhulumente niyi-disrupt. Phofu usebenzisa imikokotelo yabantu abathi hayi ndiyayazi le nto ndandike ndayenza kuyokwenziwa ii-illegal connections. So siyabacela ke abantu bakuthi uba iimeko noko ezinjengezi azisiphathi kakuhle. Abantu bakuthi mabacingele abanye abantu, la manzi siwafuna ephumile khona ukuze xa sithi abantu mabahlambe izandla rhoqo ingabi ngathi yintsomi nje esiyithethayo, ibe yinto noko apho sine-source zamanzi khona, sine-schemes loo nto ikwazi ukwenziwa ngendlela ephucukileyo. We are working around the clock to resource our hospitals. Bulk oxygen has been commissioned in Butterworth Hospital. This makes the Butterworth Hospital the first district hospital to have a bulk oxygen tank in the province. Installation of oxygen tanks at St. Harry Elliot and Mthatha General Hospital is expected to be completed by 14th of August. We have also required 100 high-low patient beds that will be distributed in facilities around Amatole and BCM, and 614 general ward beds that will be distributed to Alfred Nzo, Owar Tambo, Joe Gabi, and Christian. Critically, 90 patients monitors have been received and will be distributed to all tertiary, regional, and big district hospitals. Finalizing the staffing norms in conjunction with the National Department of Health for the field hospital have been concluded and balances needs with affordability. An additional 174 appointments were made last week, bringing the total number to 7,174 against the planned 7,652 posts against the COVID-19 conditional grants. The PMU team is now focusing on training and awareness creation on the COVID-19 response to ensure critical capacity at a point of service delivery, particularly targeted training on infection control processes. Employment relations have generally stabilized with the provision of PPE and the introduction of standard operation procedures relating to COVID-19. This week, the team is working with the National Department of Health to explore feasibility of the deployment of qualified nurses who are presently undergoing further training at COVID-19 sites during the surge. The team is also focusing on rapid recruitment for outstanding COVID-19 posts. I indicated earlier that we are entrenching transparency in government during this sixth administration. I wish to remind the media that the budget allocation for the health COVID-19 response in our province is just above 2.5 billion. The breakdown, therefore, is 800 million for PPE and consumables, 163 million for testing and tracing, 183 million for ICU beds, 190 million for oxygen, 995 million for infrastructure field hospital, 181 million for contractual staffing, 175 million for contractual community health workers, and 12 million for foreign specialist support. Through the prudent use of these financial resources, we aim to save lives and improve the standard of health care provision in our province, now and beyond this pandemic. To the people of our province, the loved ones, friends and colleagues we have lost, a needling pain in our lives, a gaping hole in our hearts, an empty space in our communities. We are in sorrow. We are in pain. We have to heal and be strong for those in our care. We have to beat this virus. We must kick it to the curb. We saw how 93.9 people in our province who were infected by this virus recovered from it. And their recovery must motivate those still infected and inspire them to the recovery. Lastly, ladies and gentlemen, we want to join the entire nation in extending our message of condolences to the Mabena family and the creative industry in general for the passing of the Gemma Bob Mabena yesterday. Bob Mabena is one of the radio personalities who made the radio medium attractive to a multitude of listeners. When he graced our TV screens, in him black youth saw their own selves and dared to dream. He was the pathfinder for the current generation of black radio and television presenters. His voice behind the microphone is off, but his legendary voice will remain etched in our minds. May his soul rest in peace. Thank you very much.
Thank you, Premier. I would like to invite AB from Mercedes-Benz SA to expound on the points that the Premier was talking about, their contribution to the fight against. If you may please drive yourself to the podium.
Honorable Premier, Honorable MEC for Health, the Director General and Superintendent General, thank you very much for the opportunity to be here today. Mercedes-Benz South Africa has enjoyed the hosting by this great province of Eastern Cape over the last 70 years. As we know, we've been here for all these years and for the last 25, 26 years exclusively building the C-Class sedans, which we are building for more than 80 markets in the world. So we've really enjoyed the hospitality of this province as we grew the business into what it is today and into a business that provides at least about 60% of the global C-Class sedan market in the world. We are deeply touched by COVID as we are part of this community and we're part of our nation of South Africa. We see the impact of COVID within our workplace, and we have had a number of our colleagues who have gotten infected by this virus, and we are grateful, Premier, that through the collaborative effort with your administration and MEC in particular with your team, that we have been able to work together to find solutions to a number of very, very difficult challenges with regard to the health of our people. It is only through our collaborative effort that we are able to find meaningful solutions and that we are able to really get victory against this virus. A lot more work still needs to be done, and Premier, we want to pledge our continued support and our continued involvement with regard to various efforts that your administration is leading within our province. Talking about what we are announcing today, it is very pleasing, Premier, that we are able to make this announcement today. And what pleases me the most is that if we look at the 3,000 face shields that we are donating today, as well as the hand sanitizers, about 2,500 milliliter hand sanitizers. All these were manufactured by our employees in our plant. And this is the effort that our employees took to say that we want to contribute towards the fight against COVID. It's of course strange that you find this useful PPE equipment coming out of our plant, but this is what our people have done in their own time within our paint shop and within our production planning department to ensure that we are able today to donate these essentials that we are donating. This comes against the backdrop of us, Premier, having also availed approximately 15,000 COVID essential packs to our learners when we started having learners going back to school. So on top of that, we are making this announcement today. We are also pleased, Premier, that we are making available 4 X-class units, which are to be used by the administration to ensure that we are able to reach communities that we don't ordinarily get to reach because of the nature of the roads that we have here and difficulty in reaching these communities. It therefore pleases us that we are able to make these units available today, which will be used by the health colleagues to ensure that we are able to do the field work that we need to do with regard to COVID, and we are able to reach as many of our communities as possible. Finally, Premier, I really want to acknowledge once again that the fight against COVID is best won through collective and collaborative effort by all of us. And to this extent, I want to acknowledge all our colleagues from Mercedes-Benz South Africa who work tirelessly day in, day out, in spite of the challenging market conditions that we have, in spite of the fact that we have pressures with what we are able to do given this scourge of the pandemic. In spite of all the challenges, our colleagues continue to work together to ensure that we are able to do what we are able to do today. And I do want to acknowledge in our midst here, Premier, the presence of a number of our colleagues from organized labor, NUMSA, who are here with us today, colleagues from the staff committee who are here today, and colleagues from the different departments within our business. So thank you very much for the opportunity, Premier, and we pledge our continued support and contribution towards the fight against COVID and towards all the efforts to ensure that we have a province which is known for excellent track record that we have seen. We are a province of the legends, with the home of the legends, and therefore we want to make sure that we are able to contribute to your tireless efforts, Premier, and your administration, to make sure that in the end we have better services delivered to our people and that we have a better life for all, which I know it is the dream that we are all aspiring for. Thank you very much, Premier.
Thank you. We will now take questions from journalists. If you can please use that microphone to ask your question, we would appreciate that. Would like to keep that mic there so that it doesn't exchange hands more often. So we are now open for questions. Oh, questions. Please come this side, Bongo. Thank you, Mr. Khotle, for the wonderful message. Okay. Any other hand? Okay. 2. Third one. 3. Okay.
The first question will go to MSc of Health. A trend we've noticed with your department in the province is the legal battles and woes with the payouts to negligence of the victims through the medical legal settlements worth millions. Besifuna ukwazi MEC ngabe le meko yoluhlobo efunekayo iphazamisana njani nomsebenzi owenzayo ukulwa nale COVID-19. And to Premier Mabuyane, how far are you with the investigation, food parcels distribution? Because we understand that there were reports of corruption in that particular event as well. And I understand it's only been a few days since you uploaded the names of the companies that are doing the business with the government, but have you received any reports so far of any wrongdoing that you might want to investigate? Thank you.
Okay. Mpumzi.
Good morning, everybody. Good morning, Premier, MEC, my question, I've got two questions, Premier. One, we had a chat yesterday. I had a chat with about 3-4 business people, some from Queenstown and one from King Williamstown. They claim that their names appear on the list. The correct amount were put there. For instance, one says he got his name, his company's name, and his name is there, claiming that they have been given a contract for 3.2, but his actual contract, which I saw yesterday, is 1.7. In Queenstown, 2 companies claim that their names are there, but they never got contracts. I just wanted to check, Premier Indua, how credible is that list? If within the space of 2 days, these lists are made available and there are people who are claiming there's incorrect information there. The second question, Premier, is that can you elaborate, play investigation here, SSA, lifestyle audit, when is it going to start? And when you say family, what do you mean? Can you just elaborate on that? Thanks.
Okay. Mr. Meeting.
Yeah. Thanks, Mawau. There are reports of critical shortage of PPEs. Can you hear me?
No, okay.
Is that okay from here?
Please.
I'll be audible enough.
No, you're not.
Okay.
Follow Premier. There are reports of critical shortage of PPEs in some hospitals in the province, like Adelaide Hospital, Fort Provincial Hospital, and Victoria Hospital. What is the reason for this, and what is the government doing to address this?
Okay, thank you. Oh, yes, I am.
Thanks. My question is directed to the Premier. It's based on the infographics as presented by the Premier earlier on. You said that we have navigated our way out of the storm as the province unexpectedly. A couple of weeks ago, you said that we are in the eye of the storm. So my question is, looking at the comparisons between July and now, the number of infections were close to 2,000 in July. Now they've, on a daily basis, now they are 177. Comparing that with the number of deaths, in July we had, on a daily basis, just over 13 deaths. Now we are in August. The number of deaths is 57 per day, as if we can use yesterday as a reference. Now, the infection rate versus now and then, there are huge disparities. I mean, I find that a little bit mind-boggling. So, the question now, Premier, is that the tracking units, are they still active? Are they presenting data on a daily basis? Because if we have 57 deaths versus 177 daily infections, if a recovery rate in 90%, ayidibani Premier ngam cela nje undiclarishele loo nto. Eyesibini sizoyi-entertaina kulaa traditional one-on-one yethu Premier i-question.
The traditional one is not on the cards. Okay, no other questions. Okay, can we start with Dr. Jagba to talk to the issues of tracing? If you can please, and then it will be the MEC and the Premier. Dr. Mengashe after Dr. Jagba on the, yes.
Thank you.
If you can come here, ma'am, please. Thank you.
Thank you, Premier and MEC and the House. The tracking teams are still active in all the areas. It is true that the numbers are going down, but the deaths are still a bit high. If we note, the people who are dying now are people who were sick during the storm. Most of them, some were in hospital and complicated, and therefore some of our deaths will take some time before they come down. So I think that is the way it is, Premier. Thank you.
You wanted the tracking. Whether is the tracking still active?
Yes, as I said, we still have tracking teams that follow patients. We still receive results on a daily basis from the National Health Laboratories. Immediately we receive results, the tracking teams sit down and plan on how to follow up on patients who have been tested positive, and then they get their confirmation of their list. After that, we then follow up as well on the lists of the patients who are contacts of the index cases. And then on the deaths, Premier, we have received a circular from National that says the people who have died and have symptoms that are aligned to COVID-19, we must treat them as COVID-19 as well, which means that if a person dies unexpectedly from a flu-like symptom, we must then follow up with that person's family and check if there are any contacts in the family or in the workplace of that person to ensure that we arrest any deaths or any complications that can come out of that death. Thank you.
This side is.
Let me just speak on two questions. I think my colleague, Dr. Jagla, have answered the first part. It takes about 14 to 21 days after an infection for someone who had severe disease to pass on. So what we see today, in terms of the number of cases that are down, we should be thinking about 3 weeks ago in terms of the death that actually we see in the system. The second one is really the definition of persons who have died in COVID. The extension of a definition to include people who passed on at home with symptoms, that will also increase the number of reported deaths, which is actually very important because it actually formally discloses. The third point is that, as you know, that the Medical Research Council did actually conduct a very extensive study to show that during this period, the expected number of deaths were actually in excess, what is called excess deaths during the period. That is actually attributable partly to COVID and partly to some other conditions. what's been very important in the province was that initially the estimated number of deaths were around about 2,000 people. 2,000 people who have actually died in excess deaths. Subsequently revision, it actually showed that there were about 1,120, which wasn't very far higher, was much more closer to the disclosed number of deaths. Now, Premier will speak on to whether we've reached the storm that we are anticipating and whether we are actually better off than we were. I think the way one reads this is that the number of people that are coming into the system, which is the new infections, is always linked to the number of people that are leaving the system, which are the recoveries. When the number of the recoveries exceed the number of the new people coming in, you then get what is called a higher level of recoveries, which is the first sign that actually shows that things are actually going right. The second way you look at it, you look in the last week's number in terms of total number of the previous week, and you look at the number of this current week. If the numbers of the current week is much lower than the previous week, it actually shows it's a very good sign that you are actually winning the battle. What the COVID does then is that in terms of our curve, we have now find our curve has moved from being stable, and our curve is starting to show a downward decline. But what's important is that we can't let go right now because there's still many people who still are susceptible. So the continuity of a program to wear our mask and making sure that we're keeping the social distance, we don't create big events where there's super infections, and we're actually able to clean our hands all the time. It means that we can actually provide and protect and prevent what is called a second wave. So all the signs are going in the right direction. Our hospitals are not overloaded. People are actually recovering and new infections are going down. And that actually shows that we might have met the surge, and we're starting to go towards a decline in the number of new infections. Thank you, Premier.
Good morning, Premier, MEC, DG and HODs and colleagues and our esteemed guests. In terms of the, I'm Mendon Zwahlana from Provincial Treasury. I'm responsible for supply chain management. I have had the issue of the 3.2. The lists that are there, we have got a centralized supplier database. And in terms of the centralized supplier database, it assists us to get all of the suppliers that we are making business with. What is then there are the names of the directors of that company. Now, in terms of the orders that have been placed by the various departments, the departments, they then supply the information on a weekly basis on Wednesdays to Provincial Treasury. And in terms of that information, we monitor and look into the supplier database if that supplier is there. So the point of the 3.2 and the 1.7, firstly, it would have been supplied to sort of say, we have got 3.2. It's the order that has been placed. We are not at this moment actually saying that is the amount that has been paid, but the orders and companies that have been awarded bids, they've been awarded bids to the tune of 3.2. What could happen is the fact that as you deliver your goods, you are then paid according to what you have delivered. You might have delivered to the tune of 1 million or 1.7. Lastly, we do welcome any complaints around that issue. We do welcome those. And our website, it is there, and we were, in fact, the very purpose why we have to publish this, it was to really see who has actually received the order, who is making business with government on the PPE. So we do welcome those, and we will immediately respond to such issues in conjunction with the departments. It does happen at times that the order that is put there is an order that is for different departments. Because in fact, we have got this company A, it would have received from education 1 million, it would have received from health a particular 1 million, it would have received. So those awards, there are actually 3 awards if it is 3 awards. But I must say, Premier and MEC, it is quite important that service providers are welcome to come with the points of clarity and complaints around those issues, and we'll deal with those accordingly. Thank you. Sorry.
You know, these secular designs, because I was still moving back, Premier, thinking that I'm moving back to a square space. Sorry about that, but I'm not yet. Good morning, Premier, and good morning, our honored guests from MBSA and our officials as led by the DG and the media. The issue I'm going to start to explain is the issue on litigations and how they impact on both service delivery and now COVID in particular. Let me explain the way first that the department is working. The department has been a department of health, and its service delivery imperatives have been on providing health. And that on its own had its source of money, which is your equitable share. And your equitable share, of course, is tempered with in a negative way because of litigations. Precisely on the basis that a health department, in doing its work, will never run away from litigations, Premier. Because health, as a dispensation, as a discipline, will always be exposed to mistakes. Some, not necessarily that they are negligence, but some could be about negligent actions and occurrences. Those are the issues that we would go through, trying to explain and argue in a court of law when we are challenged. And to a certain degree, I do want to actually say this, Premier. We have gone through a curve because of a particular decision of a court, which is now looking at us, looking at the issues and the amounts you would recall, in particular on issues of cerebral palsy, where people would claim to even more than 30 million. Now that we've got that victory in terms of the court, we're looking at a case where we have assessed the ability of the department to actually take on board the caring of that patient through such that imali that actually gets paid is not necessarily a lump sum. It is rather staggered in terms of the life of the patient or the victim. To a certain degree, that's going to assist because most services would be rendered by the Department of Health. The fact that we've had the litigations, yes, it is hampering the actual success of the department, because money for litigations, Premier, unfortunately, is not budgeted for as a contingency in the budget. PFM8 does not yet allow it. It is a matter, Premier, that maybe, as most of us are now talking about that because it is health, it should be allowed to have a contingency fund that actually takes into consideration those that are not necessarily about negligence. The second part is the impact on COVID. COVID in its nature has got a grant where government has declared to give particular amounts to provinces. We were no exception. Because of that, those amounts are ring-fenced for COVID-related issues. In a sense, therefore, what the Premier is standing here and elaborating in terms of the successes of the department and the PMU's work is precisely because those monies are available and are not tampered with, except if it is COVID. I hope I've answered your question. On the issue of talking to critical shortages of PPEs, specific areas have been listed here as Adelaide, as Fort Beaufort and Victoria. I must confess that those are issues I do not know. But as far as I know, we have gone through the big challenge of PPEs in the Eastern Cape. When we started, yes, precisely on the basis that there's linkages of health, and PPEs are not only about COVID. They are an extension, and the pressure, of course, has been added because of the nature, how COVID presents itself, and the importance of our healthcare workers to be safe and to always be sure that they are ready to treat our patients. I will have to go specifically if Adelaide, Fort Beaufort and Victoria are mentioned. However, in my office, I must announce this, I do have stock for intervention when there are such issues. It has not come to my office. There would not ordinarily be issues that come to my office to intervene whilst their orders are in the run and are not yet in them. I must hastily actually announce that what we found when we were assessing stocks in our hospitals was that some managers do hoard to stock in preparation. As Premier was standing here and was talking to saying we're looking at a peak, which is up to September. Other people, when we get to them, the managers say, we are keeping this stock in case when we get there, it will be a chaos and nobody has stock. We've been talking to such managers to start to say, please release stock, because PPE in its nature do build confidence with our healthcare workers. The fact that they don't have it might actually take us back to the days that you saw protests in the streets, which are no more an issue in the streets today. So it's an issue that I will actually get in there and look at. I do want to endorse, though, that he was right to Premier when he said we are looking the storm in the eye. Even now, when he says we're seeing numbers going down, we're not dropping our guards, because we are not yet through the very period called winter, which is one of the issues, Premier, maybe that we may explain. To start to say we are really humbling ourselves, requesting our people that then when they actually see flu that does not seem to be subsiding, they must immediately seek for help. Because majority of the people that we lose are people who start to do home remedies when they want to believe, even during COVID, it's just normal flu. And it is only at the time that they lose their taste buds and sometimes they get to lose their own oxygen levels in their bodies that they run to our facilities. And sometimes it may be too late. It is important, uPremier kunegama lisebenzisayo. Ela gama lakhe ndingalazi uba lithetha ukuthini, kodwa ke ndiyalithanda, that we've got our comorbidities. And the fact that you may be hypertensive, you may be diabetic, you may be having cancer, you may be having HIV, those issues in its nature are those people that you want to believe must jump at the first sign of understanding that my health is not in. The majority of the people of the Eastern Cape, unfortunately, poor as we are, in terms of lifestyle, we are majority a group that is in the group of being obese. And that you are obese, that's also another weakness. That actually weakens our own system for us to be able to, to be easily attacked by certain conditions. And for that, Premier, I want to believe that those conditions themselves could be adding to the numbers that we're losing our people. The time they take to seek help and the time they take to stay at home. We're not saying the remedies, home remedies are wrong, but what we're saying, be careful, watch yourself as you use them. Don't go too late. Some people are now buying oximeters that they are actually able to administer at home, because it is very difficult to leave yourself to have lowered oxygen. At the time you get in, your lungs are compromised. Thank you very much.
Thank you very much, MEC and the administration leadership that with the answers that you have given. Just to buttress the point on the first question on medical legal, yes, of course, the medical legal claims have eroded the baseline of the department. That's a fact. That's the reason why the system, healthcare system, has been really, really crippled over a period of time because of this. That's why we've been concerned about this. But some work is being done. DG and the OTP with the team that is being set up to deal with this, but also the intervention that has been made to make sure that we contest every claim that is put against the government in any court of law. That is being done to really try to recover from that, because money that has been used on these legal claims have been the service delivery money, has been the money to improve our healthcare system, really ramp up our system to respond to the challenges that we've been having over a period of time. I'm not just sure about the question on food parcel distribution allegation, to be precise. I know that a lot of noise has been made around this. A Kalabalu has been created. Out of more than 4,000 councillors, or many than that number in the country, not necessarily in the country, probably even here in the province, we had not really more than 10 kind of allegations of such cases. So an impression was created that councillors are corrupt or people who are distributing food parcels are corrupt, which is completely wrong. Which is completely wrong. I think it's something that we need to rebut. We've been having very patriotic, reliable food soldiers in the form of public representatives who are councillors, who have been doing their work diligently on the ground. That they constitute a bigger percentage of what I will call small, kind of a few rotten potatoes in the bag, so to speak. Even that one, MEC Cocta is investigating. We have seen a couple of announcements that he has made in the public, where on issues of this nature that he has been coming very strong. And we've been supporting that where there is that and found to be correct, there must be consequences. And that consequential intervention we've been actually observing from the MEC Cocta. So even on that one, I would probably appreciate specifics even outside here, so that we can definitely make a follow-up if you do have any councillor that you know, or any public rep or any person that might have manipulated such out there. I think we have not yet received any wrongdoing on the list that have been published. I think in the statement that I read earlier, we said part of the purpose or intention is to invite this kind of scrutiny from the public, so that people can come forward with whatever that they have out of what has been publicized, so that we are able to deal with that. So we are all out there. I've instructed Treasury as early as May, when we realized that we were likely to go through turbulence around this issue of PPE, to say, Treasury, do an ongoing audit to an extent of investigation in certain transactions that might be really suspicious. So Treasury is on that. They are doing that on an ongoing basis. I think Ms. Mendo Dugada Ntswahlana has tried to explain, Zuzile, that those people must not go and complain to you. You are not a law enforcement agent. You are not you are a journalist, probably you're doing your investigative journalism, you are right. We have said there, people must come forward to report that, and we're even saying go and report it to the relevant authority if you feel like there is something that is untoward. But a logical way of doing it, firstly, will be for that particular individual contacting the Department of Treasury, explaining the problem, so that Treasury can investigate the matter. If is there any fraud committed in the process, then the matter will be dealt with. So the purpose of us going public in that way is to ensure it has never been done before. We are one of the few provinces that have done. We are not perfect, but we want to perfect the system. So that's a kind of an attitude that we have adopted. So we will encourage many, there might be bigger than what the number that we have spoken to, Mpumzi, many that are out there who might be having queries around that. They must easily come forward and deal with that. The family extension, you would remember that in South Africa there is no law that bars or that forbids family people not to do work with government. But it's a moral question that is being raised. It's a moral question that my wife, as a premier, can be found to be doing business with government of Eastern Cape or with the OTP, a department that I'm an executing authority on. So it's a moral question that with the kind of the corruption that we've seen endemic in the system, will that be tolerated? Is it something that can be done? Yes, of course. Laws allow that. But we are revolutionaries. I think we're trying to correct our revolutionary morality as we deal with these kind of challenges that we confront. It's not an easy thing, but at least we are limiting it to spouses. So at least you, a person, and your spouse, you should be able to be. But it doesn't necessarily mean that if your brothers and sisters are all over the show doing work with government, that matter will turn a blind eye on. So, and it doesn't necessarily mean that by virtue of them doing government, the business with government, they are corrupt because their relatives is in charge. So what is important is to strengthen, is to actually ramp up our system to really detect such kind of corruption. I'm quite happy with the National Treasury decisions to say, even if we are in a disaster, that let's go back to the normal supply chain. Let's improve system. Let's no longer talk about disaster, shortcut, deviations, and all such kind of issues. Let's follow process, look at the time, because you can't have a supply chain that will take about 2 months to procure something when you need it within a week. But let's go public. Let's follow the normal supply chain processes that are actually articulated in the PFMA. So I think that attitude now seeks to say, let's be transparent as much as we can, so that even those can be protected. Because people can go and compete like any other people, get business. Doesn't necessarily mean that they are corrupt. But as long as we are really not transparent there will forever be this kind of an attitude that some were done favors. But if it is done public, everyone looking at it, seeing it, the debate of all these kind of things that we see surely will be dealt with. We want to deal with malfeasance in the system. We want to deal with corruption in the system. We want to uproot corruption in the system, because corruption is an antithesis of progress and development. So all of us, we must commit ourselves into that and try our level best to clean the system as we move forward. And attend to every query that is out there that seeks to create an impression around issues of corruption. So I think the issue of the lifestyle audit, it's something that is done in other advanced democracies as well. It probably we took long here to do it. But one thing that I want to assure you, I've really tried to preach this, that there must be a Chinese wall between politicians, executing authorities with supply chain. That's why we've brought officials here to explain this. And from where I'm standing, I don't even know what's going on at OTP. I don't even know what's going on in other departments on supply chain. Politicians only deal with issues of supply chain at a point when there is a query about a process. When there's that query comes, you only get alerted and then you begin to ask a question. What has happened there? Other than that, you literally don't know. That's why we've said part of it that we must include. We know the system has been captured. We know. And we've been speaking to a number of other business people out there where they will tell you that there will be something called a release fee. You get work, you are expected to do this work, but at a point when you're supposed to be paid, you must go and pay someone for you to be paid. These are things that are happening, and we cannot turn a blind eye on that. And in most cases, officials are very much active into that. But it's easy to jump into politicians and blame politicians. There are no holy cows. This is the attitude that we're adopting. Let's dig deep onto this, really uproot this issue, and really deal with the issues of trust deficit that seems to be emerging out there. I think MEC have dealt with the issues of shortages around certain hospitals. We should not be having that. I think the reason that we have also set up the monitoring platform where MEC meets with labor on a weekly basis, the safety committees, occupational safety committees in hospital, is to look around these issues. The protection of frontline is our preoccupation, is our priority. We've got to protect. The number is actually very bad at 5,000. I've been visiting hospitals. I could see elements of negligence. I would be calling some nurses, I would be calling some doctors, but why are you so relaxed like this? But you should have been wearing something like this, but you didn't. I've been correcting them. So an element of negligence is also there. But we can't allow that to continue. That's why we said managers must manage so that people are fully complied with this kind. We can't allow this ever-growing number of infections that we see out there on the front line, particularly the health care professionals. So there's an issue that we definitely want to deal with. I think many speakers tried to speak on your question, Dr. Jakla, Dr. Mbengash, I think as well as the MEC. The point we're making, I think it's a point that the Minister was making earlier today in the morning. I think the analysis done by the South African Medical Research Council around this issue of the surge versus the plateauing that we're observing. And what we're saying, we are probably, we don't want to be hyper about it, we probably might be reaching what we anticipated earlier. So this is what is being, so we don't want to work on these issues. This issue is not based on assumptions and also kind of, assumptions, so to speak. We're not dealing with the economics here. We're dealing with a disaster. We're dealing with a virus. We must base everything that we say on empirical evidence. That's why there's an ongoing research so that we know what informs this decline, what informs this plateauing, so that we don't do it this month, next month we're back again. We should assess, we should analyze, we should see what impacts. We could have gone down simply because we closed down schools. We could have, because already we had a hit when schools were up because there were a lot of outbreaks in a number of schools. We could have gone down simply in hospitals as well, more beds made available and more decanted, simply because of the issue of the ban on liquor. Even that one cannot be permanent because the economy of this country cannot continue like that. We've got at some point allow the liquor sale back to allow the business, the industry to go back to normality, because there are thousands and thousands of job opportunities that we might likely lose in that sector. So we can't continue like that, but we were looking at the period when we were actually looking at our modeling and projections that were made in terms of the likely surge period, etc. So as we move forward and as we see, so surely National Command Council is working on that, looking at more kind of a approach to the risk-adjusted lower levels as we move forward. So we would appreciate that, because we have said as we fight this COVID in saving lives, we must balance that with the preservation of the livelihood. Our people must still wake up and go to work, just like many of you who are here, and many other people are now unemployed, and we're losing a lot on that. So it's going to be important that we go back. So we're not necessarily saying that we are at that point younger. No. We're saying we are observing, and that's a fact. And the numbers, that's why we've said, I was quite happy to listen to Minister, and it's a point that I've raised about a month or 2 months ago here, that we are seeing a lot of people dying at home, and we know what's going on in rural areas. If you die at home, you don't need the doctor to come and certify, especially if it is viewed to be natural death. You need a traditional leader or a councillor to come and call a funeral parlor to take a body, full stop. And as we have said, these are PUIs. They must be treated as PUIs. Can we make a follow-up on this so that we protect those who are remaining behind? Try to do these post-mortem swaps where there could be issues of people dying because they were feverish and all that. So there's a point that we've raised. I was happy with the minister today when he was saying it's something that we are actually moving towards, as we see. And I immediately instructed our data analysis center, EXEC, can you investigate this? Can you juxtapose these numbers? Can you do this comparison? Look at figures, pre-COVID and post-COVID, daily, weekly, monthly. What does the situation tells us about this? It's only Home Affairs who can give us that data, that real-time data. Whether you've died with COVID or no COVID, you have died, and Home Affairs will give you a certificate. So it's up to us getting that data, analyze that data, and see all those who have been certified by doctors versus those who have just died at home. It's either they were old. It's continuing. People are dying. I was at home myself about a week ago, burying an old mother at home, a family. She died at home, and people say, no, she has been like this for long. She has not been well. And we know many people go to hospital because they've got asthma, but they get tested there negative, or at the end they test positive. So it's important that we are vigilant around this issue and make sure that we protect our people as much as we can. So that's why we have said, over and above the significant contacts, as we look and analyze numbers, but we must also look at this approach of household. And now if we've got a case in this household, treat everyone in this household as a significant contact so that we test, especially that we've seen a lot of people who are so asymptomatic, but are also positive. And they are very dangerous in spreading that as well. So we want to stop the transmission of the virus, but we appreciate the decline on numbers. We're expecting the surge. The kind of projection still tells us that we are still likely to go to that. We are not going to lower our guards. We're preparing ourselves for any eventuality to ensure that government is ready to confront any kind of a challenging situation. Thank you very much. I'm very late for my next meeting.
Thank you very much, Premier. We've come to the end of this part of the media briefing. We will now go outside to look at the PPE and the vehicles from Mercedes-Benz SA. We will allow you guys to take pictures and have a good day.